You've probably seen the ads, melt away your fibroids naturally, or shrink fibroids without surgery. But here's the truth, if someone is selling you a miracle cure for fibroids, they're selling you false hope. I'm Dr. Anim, and today on Health Made Simple, we're cutting through the noise about uterine fibroids. We'll cover what they are, the real treatments, and the truth about those so-called fibroid-melting products. We'll also talk about fertility risks and what you can do to lower your risk, especially for Black women who are disproportionately affected. Let's get into it. Uterine fibroids, also called myomas, are non-cancerous growths that develop in or on the uterus. Think of them as benign tumors, abnormal, but not cancer. In fact, the risk of a fibroid turning into cancer is less than 1 in 1,000. They can range from the size of a seed to a melon, and by age 50, up to 80% of women will have them. Most won't even know it. But here's a critical fact. Black women are 2 to 3 times more likely to develop fibroids, often at a younger age and with more severe symptoms. So, what causes them? The honest answer is, we don't know exactly. But hormones, especially estrogen and progesterone, play a huge role. That's why fibroids usually appear during your reproductive years and shrink after menopause. Genetics matter too. If your mother or sister had fibroids, your risk is about 3 times higher. Other risk factors include starting your period before age 10, obesity, a diet high in red meat, and high blood pressure. For many women, fibroids cause no symptoms at all. But when they do, heavy menstrual bleeding is the most common one. We're talking periods lasting over a week, soaking through pads every hour, and passing large clots. This can lead to anemia, leaving you feeling exhausted. Large fibroids can also cause pelvic pain, a feeling of fullness, pressure on your bladder making you pee all the time, or even constipation. Now, a big question I get is about fertility. Here's the good news. Most women with fibroids can get pregnant and have healthy babies. Only about 5 to 10% of infertility cases are linked to fibroids. The location is key. A fibroid inside the uterine cavity might interfere with an embryo implanting, but fibroids on the outside wall often cause no issues at all. If you have fibroids and want to conceive, it's important to get evaluated by a specialist. Okay, let's tackle those fibroid-melting products you see all over social media. The blunt truth? There is no pill, supplement, or herbal remedy that can dissolve or melt away fibroids. It's pure marketing that preys on women looking for an easy fix. Things like green tea extract, turmeric, or castor oil packs have not been proven in any rigorous scientific studies to eliminate fibroids. Believing these claims is dangerous because it can delay you from getting proper medical care, allowing fibroids to grow larger and symptoms to worsen. If there was a magic pill, every doctor in the world would be prescribing it. So, what are the real evidence-based treatments? For mild symptoms, we often do watchful waiting with regular ultrasounds. For managing symptoms like heavy bleeding, hormonal birth control like an IUD or the pill can be very effective. There are also non-hormonal medications that can reduce bleeding. Minimally invasive procedures like uterine artery embolization can shrink fibroids by cutting off their blood supply. For surgery, a myomectomy removes the fibroids while keeping your uterus, which is the choice for women who want to preserve fertility. A hysterectomy, the removal of the uterus, is the only permanent cure, but it ends fertility. The right choice depends on your symptoms, your goals, and your health. Finally, can you prevent them? There's no guaranteed way, but a healthy lifestyle helps. Maintaining a healthy weight, eating lots of fruits and vegetables, exercising and limiting alcohol can reduce your risk. For Black women who have a higher risk of vitamin D deficiency, taking a supplement might be beneficial, but talk to your doctor first. Given the higher risk, Black women should be especially proactive. Don't dismiss heavy periods or pelvic pain as normal. Advocate for yourself, get regular checkups, and find a doctor who takes your concerns seriously. Here's the bottom line. Fibroids are incredibly common and usually benign. Real treatments exist to manage symptoms and improve your quality of life. Don't fall for scams promising miracle cures. And most importantly, if you're experiencing symptoms, talk to your doctor. If you found this video helpful, please like, subscribe, and share it. Let me know in the comments what health topic you want me to cover next. I'm Dr. Anim, and this has been Health Made Simple. Stay informed, stay healthy, and I'll see you next time.